I am Jaquelyn Jahn. I am an assistant professor in epidemiology at Drexel University, Dornsife School of Public Health, and also the Ubuntu Center on Racism, Global Movements, and Population Health Equity.
Well, thank you for being here and talking to us about the two research projects you were involved in that resulted in some papers. And the first one has this great title of, just because it's so long, Gestational Exposure to Fatal Police Violence and Pregnancy Loss in U.S. Core Based Statistical Areas 2013 and 2015, which I think that probably could be explained for the layperson. And then the third one, which is even more shocking in many ways, neighborhood proactive policing and racial inequalities in preterm birth in New Orleans, 2018 and 2019. So if you, which one would you like to start with? I think either one would be good. Okay, let's start with the gestational one, because it seems to cover a larger scale and draw some very specific correlations, I guess, or connections is probably a better word. So if you could if you would explain to us what the paper sought to do and how you went about conducting the research.
Yes, absolutely. So the purpose of that paper was to try to understand fatal police violence as a stressful exposure that happens in many people's lives, but it might have a particularly important implication for people who are pregnant, and how living in a place where an incident of fatal police violence happens might be linked to a lost pregnancy. And so what we did was we brought together some national data on births and pregnancies, and also some data on fatal police violence. And we looked at what you mentioned on core-based statistical areas. Really just what that means is small and large US cities. And so we're focusing on urban areas because that's where the majority of fatal police violence happens. And we look in time to try to understand after the date of conception, or our estimated date of conception, when a pregnant person might be exposed to an incident of police violence in their city. And if there are changes in the number of live births in those after post-conception months. So you might know that in the US, our monitoring for understanding miscarriage is really not robust, especially when we compare it to our really in-depth monitoring of other causes or other mortality at other ages, and other births that are in the hospital. So the way that we identified pregnancy loss in this study was looking at changes in the number of live births, because when we link that to the exposure timing or an incident of fatal police violence, it can help us get a closer understanding of miscarriages that happen or other forms of pregnancy loss. Yeah, so that's the big picture. Any questions from there?
Yeah, quite a few. So you mentioned, like in the introduction to the paper, that fatal police violence can be understood as a population level stressor. And I think this is an important thing to unpack, as far as when someone says, I witnessed this police violence, what effect does that have on someone who isn't necessarily the object of that violence?
Mm-hmm.
Your neighbor, loved one, friend, someone in the neighborhood.
Absolutely. Yeah. And the other really important piece to think about when we're thinking about police violence as a population level stressor is that that type of stress means something differently across racialized groups because of the really significant ways that racism has structured policing and the disproportionality in fatal police violence across racialized groups. So Black, Latinx, Native Americans, and some Pacific Islander groups also experience just such higher levels of fatal police violence that the psychological impact of those events is just different, is interpreted differently across communities and individuals. So when this study is drawing on a lot of other research to inform our hypothesis. There have been a lot of other studies that have interviewed people, that have looked at survey data to try to understand and unpack the implications of police violence on stress, on mental health, on well-being. And really, it can be understood, especially for racially minoritized groups, as this chronic stressor. And the exposure to it might happen, live and close, face to face, but it also might happen through social media, through news, especially in a time when videos, surveillance of incidents of police violence are so publicly available, and when exposure to those really tragic and harmful events is sometimes not preventable because it's just you open your phone and go on social media and then it's there. The mental health implications of that kind of exposure are really just starting to be understood scientifically, but communities have been articulating that for a long time too.
So I'm trying to set this up so it kind of forms a narrative that is understandable to someone like me who doesn't understand the statistics and how these research projects are put together. So if you kind of walk us through how you start with this problem and you start with research that you explained very well. How do you design this project so that you can find what you're looking for? It seems such a huge landscape and such a small little needle to find. Additionally, when you start remembering how poorly police violence is reported, or not reported, is documented. And there isn't a national registry, and the FBI is relying on self-reporting by localities and this kind of thing. So how did you do it?
Thank you. I appreciate that question. And yeah, just if there's anything that I could clarify further, feel free to interrupt me at any point. So I'm really glad you're bringing up this point about the monitoring of fatal police violence. This is a really, really important point to me as an epidemiologist. Like I was talking about with the monitoring of the fetal deaths, in the bread and butter of being an epidemiologist, of understanding why populations get sick and who in populations get sick, is having really robust public health monitoring data. And we have that for most causes of death. We have a really strong vital statistics infrastructure in this country. But when it comes to police violence as a cause of death, that infrastructure just is really substandard. And that is not a personal opinion. That is something that the Federal Department of Justice has said. We just do not have a robust federal monitoring system for these deaths. And so what people have done to fill that really important gap is set up these crowdsourced and media-sourced information source gathering systems. So the one I used in this paper is called Fatal Encounters. It's actually being discontinued, but there's other ongoing ones, including mapping police violence. And so what those systems do is take any kind of media mention of police violence and start to link together maybe obituary mentions of this death, other types of police and public records data on what's happening, and fill in some of the information on what happened, including cause of death, etc. And start to piece together and then also validate really what happened. So that's our broken monitoring system, and that's the first step to answering any kind of research question on police violence and why it might matter to families and communities. And then your broader question about how do you design a research study like this? So it is quite hard to do because you're kind of piecing together these multiple sources of data that are usually not linked together. What we did was we looked at when and where conceptions were happening and when and where fatal police violence was happening, and used that to sort of link people and places over time to understand these trends in live births across place and how that might differ when incidents of police violence happen. But yeah, there are not great or straightforward national survey data to try to answer these questions. So this and other studies try to piece together different types of administrative data sources.
Well, it's important too, because then once you've done that, other people can use that data set to further their research on similar topic, right?
Yeah.
So you have now all the data that you would have collected. What did you find in getting into the data?
Yeah. So because of that differential racialized impact of police violence, we were really interested in knowing how incidents of police violence might affect pregnancy loss differently across racialized groups. What we found was a decrease in the number of live births associated with exposure to police violence among Black women when they were exposed to that violence early on in pregnancy. This is from the physiologic research that we know, early in pregnancy is really especially a vulnerable period for stressful exposures. And like the stressful exposure we're thinking about in this study. So identifying that early pregnancy effect kind of aligned with some previous research. We also found an effect among Hispanic or Latino pregnant people and Asian pregnant people, but we found no change among white people.
Can you explain that a little bit more? Because I was a little bit, yeah, what can you draw from that? Is it that white people aren't exposed to violent police action, or are they, what's going on there?
Yeah, so that is a good question. So in this study, especially because we're focused on cities, there were many white people who were exposed to police violence during pregnancy. It just didn't change the rate of pregnancy loss. And so what we were hypothesizing is that it's because of this differential effect of police violence specifically for racially minoritized people.
Right, and I guess, well, I'll get to that in a minute. So from this, what you found, what did you conclude? What was the discussion piece of the article? That narrative is very fascinating.
Mm-hmm. Yeah, and tell me if there's a specific piece of it you want me to mention, but really what we wanted to focus on was first identifying that there are harms of police violence, and that is a public health problem, but also that those harms don't just extend to the person who dies in that police encounter, but also extends to minoritized people living in those cities and in those communities. There are these kind of ripple effects of perpetuated harms and inequities that result from police violence, and that is part of the public health problem that we wanted to articulate in this study. Yeah.
Well, and I think that that is something that needs to be stressed more. And the second paper deals with over policing and how that impacts neighborhoods. But I guess one of the questions that jumps out at me is, how does this actually lead to, miscarriages or low birth weight or loss of pregnancy? Because it seems that it makes sense that it does, but then it also, the immediate question is, why does it?
So I have to be really clear that we weren't able to test any of those mechanisms in this specific study, but what we know from previous research that surveys people and their exposure to police violence is that this kind of exposure, even through media, is associated with antenatal stress and depressive symptoms, especially for pregnant people that have, especially for Black pregnant people that have children. I think the hypothesis there is thinking about one's own risk and the risk of their family members being killed by police or in incidents with police. Really, really heightens the impact and implication of witnessing police violence or being exposed to police violence.
And I think it probably bears some mention that this isn't the single cause. This is a contributing factor, right? As far as, we haven't thought of police violence or police action affecting pregnant people until recently. We haven't thought about how incarceration of a family member affects families and all sorts of mental health and all that kind of stuff. So I think it's really important that your research makes that very clear and draws that line straight across the board.
Thank you.
So now let's get into the second one, which is proactive policing, which is a hot topic of every discussion about policing. Can you explain first what proactive policing is and how it affects BIPOC communities and underserved and poor communities?
Yeah. So proactive policing, there are many definitions of it out there. The one we used in this paper was police stops that aren't the result of a citizen requesting that police presence. It's on the basis of police officer discretion. And affected communities and activists and advocates have for a long time been identifying the ways that racial bias comes into play, especially when we are relying so heavily on police officer discretion. Who is deemed dangerous is a highly racialized idea, and there's a lot of room for mistreatment, bias, and potentially fatal consequences.
Yeah, and I appreciated the definition very much because of running that line toward police accountability for their discretion and how that discretion is not only biased but also then affects the community that it's being enacted upon was really well drawn. And I think I would love for you to explain how this paper was set up using that hypothesis of what, or that definition of policing and the effect it would have on, again, mothers and pregnant people.
Yeah. So whereas the focus of the first one was on all cities in the US, this one really narrows in on New Orleans. And I'll say that the reason for that focus is in part because two of the co-authors are at Tulane, live in New Orleans, and know a lot about the context there. But also because New Orleans as a city has been under federal consent decree, which means a process of federal investigation, their police department for constitutional violations associated with police stop incidents. So that is why actually, I think we have these data that are publicly available. So usually the public has no way of knowing how often police are stopping residents, where those stops are happening, if there is any kind of bias or inequity in the stops. Those data just aren't usually shared publicly. But often the result of a federal investigation is that we have that kind of federal data or city level data transparency. So that was a good starting place for what made this research possible. And then we have data on where in the city exact geocoordinates of that stop happens. And then we also know the exact coordinates of where birthing people are living during pregnancy. And so we were able to look at rates of proactive police stops in all the neighborhoods in New Orleans and link them to, in this study, we looked at preterm birth, which is a birth that occurs before 37 weeks gestation. And so similar to the last study, we wanted to look across racialized groups. And in this study, we specifically focused on Black and white birthing people.
And how did you, what did you find, and what was the analysis of the statistics that you get?
Yes. So statistically here, we're looking at whether a birthing person who lives in a neighborhood with a really high level of proactive policing is at greater risk of preterm birth compared to someone who's living in a neighborhood with low levels of proactive policing. And what we found was for Black birthing people, they were more likely to have a preterm birth if they lived in a neighborhood with really high levels of proactive policing. But actually that wasn't true for white birthing people. There was no relationship between levels of proactive policing and preterm birth.
Was the proactive policing the same in those two communities?
Great question. The other really important thing that we wanted to show in this paper was just the vast disproportionality between what pregnant people are experiencing in terms of their neighborhood's level of proactive policing across racial groups. So let me pull up the statistic. Yeah, nearly 20% of Black birthing people lived in those neighborhoods with the highest rates of proactive police stops, 20% compared to 8% of white birthing people. So there's just a huge disproportionality in exposure to proactive policing that's happening in New Orleans.
Yeah, and that was, I mean, again, it makes sense, but again, it's so stark to see the actual statistics proving the point. So, I mean, you did some really granular level data collection on this. So your conclusions, I think, are pretty solid. So if you could explain what you found and what conclusions you drew, narratives you created.
So the other point I forgot to mention is that in our statistical modeling, we adjust for a variety of other neighborhood sociodemographic factors to try to rule out these sort of alternative explanations. So some of them included like percent of poverty, percent of residents with less than high school education or unemployment, or rates of calling police, to really try to narrow in on the impact of proactive policing specifically. And yeah, what we found was that Black birthing people were not only disproportionately exposed to proactive policing, but also had higher levels of preterm birth when they were exposed to the highest levels of proactive policing compared to birthing people who were living in neighborhoods with the lowest levels of proactive policing. And that just isn't true for white people.
And I suppose in talking over this research with a coworker, someone asked, how much of this is neighborhood and environmental? Could that be a criticism of someone who was looking at your paper and saying, well, why are you blaming the police when there are these other factors you just mentioned? And
yeah. I think we need to complicate the story a little bit, because who lives in which neighborhoods, and especially the ways that neighborhoods have been policed over time, is a really complex historical experience that probably your listeners have been diving into quite a bit over the series. But especially when we think about histories of disinvestment and levels of opportunity and economic growth that are happening across different neighborhoods, we know that it's not happening in the same neighborhoods over and over, and those are disproportionately where Black and other people of color are living. So it's this history of residential segregation that impacts where policing is happening, and also, increases risk of preterm birth. We do adjust for a variety of those factors, so we're able to start to rule them out in this study. But it would be too simple to say that it's definitely policing versus it's definitely racial segregation, because of the ways that racial segregation and policing are intertwined.
yeah, and I think it also adds a link in the carceral chain, if that's a possible thing I can say, that is, just what I'm trying to say is motherhood is so fragile in its physicality, and the amount of stress and things are only now being studied in other areas. So it makes sense that this carceral system that segregates populations and subjects them to a punishing regime of surveillance and interference would have direct results on mental health, physical health, prenatal health. And how did your work then connect those chains? And have you had successes with these papers?
Yeah. So what this, each paper tries to sort of tell a different chapter of a larger story, right? And so looking at these two papers together, in the context of what other work I've done and what other scientists have done, we know that broadly, carceral systems, that includes policing, but also, like you're saying, incarceration, is vastly racially disproportionate, racially inequitable, and just racist. And that there are harms to bodies, that there are physical harms, there are mental harms, that are perpetuated by these systems. We live in a country where the levels of police contact and the levels of incarceration are so astronomically high in comparison to similarly wealthy countries in the world, that we just have to think about the carceral system as this fundamental piece of American life. And that's why I think it's really important to think about this really important social experience in terms of health inequity, and who lives and who dies.
Yeah, and I think it goes a long way to help explain the constant stressor that some of these communities live under daily. So this is another manifestation or result of that is that pregnant people are losing their pregnancies based on this, correct? So I know that you probably don't have the answer to this, but I'm going to ask anyway. What do we do about it?
Yeah. Well, I don't have the answer to that, but what I do find encouraging and what the American Public Health Association has released in policy statements to say is that we need to think very seriously about investing in really robust social safety nets and social systems that are community-based and community-led. And in doing so, we not only, invest in all these social determinants of health and prevent or mitigate unhealthy exposures, but we also, in a lot of cases, can prevent exposure to policing or criminalization or incarceration. That when we really give everyone an opportunity to educational attainment, to economic opportunity, we can prevent a lot of violence, of harm, and of perpetuating trauma, especially across racialized groups.